Certainly. Here's a more detailed and expansive overview of diabetes mellitus, covering its types, pathophysiology, symptoms, diagnosis, treatment, management strategies, complications, and emerging research areas. Diabetes mellitus, or DM, is a group of metabolic disorders characterized by chronic hyperglycemia, which means high blood glucose levels resulting from defects in insulin secretion, insulin action, or both. This condition can lead to serious complications affecting various organ systems over time. Type 1 diabetes mellitus, or T1DM, is an autoimmune disorder where the body's immune system attacks and destroys insulin-producing beta cells in the pancreas. It typically manifests in childhood or adolescence but can occur at any age. The symptoms have a rapid onset and include excessive thirst due to fluid loss, frequent urination as the body tries to eliminate excess glucose, increased hunger as cells are starved of glucose, weight loss despite normal or increased appetite, and fatigue due to lack of glucose for energy. Management of T1DM requires lifelong insulin therapy, which could be through injections or insulin pumps, regular blood glucose monitoring, and dietary management. Type 2 diabetes mellitus, or T2DM, is characterized by insulin resistance, where the body's cells do not respond effectively to insulin, often accompanied by relative insulin deficiency over time. It is more common in adults, particularly those who are overweight or obese, but is increasingly diagnosed in children and adolescents due to rising obesity rates. The onset of symptoms is gradual and may include increased thirst and urination, fatigue and weakness, blurred vision, slow-healing sores or frequent infections, and areas of darkened skin, particularly in the armpits and neck, known as acanthosis nigricans. Management involves lifestyle modifications such as diet and exercise, oral hyperglycemic agents like metformin, and insulin therapy if needed. Gestational diabetes mellitus, or GDM, is a form of diabetes that develops during pregnancy when the body cannot produce enough insulin to meet the increased demands. The risk factors include obesity, a history of GDM in previous pregnancies, a family history of diabetes and certain ethnic backgrounds. Often it is asymptomatic and typically diagnosed through screening during pregnancy. Management involves diet control, physical activity, and possibly insulin or oral medications. Close monitoring is essential to prevent complications for both the mother and the baby. Other specific types. Maturity-onset diabetes of the young, or MODY, is a rare genetic form of diabetes caused by mutations in a single gene, leading to impaired insulin production. It is often diagnosed in adolescents or young adults. Latent autoimmune diabetes in adults, or LADA, is a slow-progressing form of autoimmune diabetes that occurs in adults and may initially be mistaken for type 2 diabetes mellitus. The pathophysiology of diabetes varies by type. For type 1 diabetes, the autoimmune destruction occurs when the immune system mistakenly targets pancreatic beta cells, leading to absolute insulin deficiency. Genetic and environmental factors play a role with genetic predisposition, such as HLA-DR and HLA-DQ genes, combined with environmental triggers like viral infections, initiating the autoimmune process. Type 2 diabetes, insulin resistance. Cells in the liver, muscle, and fat do not respond effectively to insulin, leading to decreased glucose uptake and increased blood glucose levels. Beta cell dysfunction. Over time, the pancreas cannot produce enough insulin to overcome insulin resistance, leading to relative insulin deficiency. Hepatic gluconeogenesis. The liver continues to produce glucose, exacerbating hyperglycemia. Diabetes symptoms can vary based on the type and duration of the disease. Common symptoms include polyuria, increased urination resulting from osmotic diuresis due to high blood glucose levels. Polydipsia, increased thirst due to dehydration from excessive urination. Polyphagia, increased hunger due to lack of glucose uptake by cells. Fatigue due to the body's inability to use glucose effectively. Blurred vision caused by fluid changes in the eyes. Slow healing infections or cuts may heal more slowly due to poor circulation and immune response. Diagnosis of diabetes is established through several blood tests. Fasting plasma glucose, or FPG. A fasting blood sugar level of 126 milligrams per deciliter, or 7.0 millimoles per liter, indicates diabetes. Oral glucose tolerance test, or OGTT, blood sugar level of 200 milligrams per deciliter, or 11.1 millimoles per liter, 2 hours after administering a 75-gram glucose load. Hemoglobin A1C, or HbA1c. A level of 6.5% or higher indicates poor long-term blood glucose control. Random plasma glucose, a random blood sugar level of 200 milligrams per deciliter or 11.1 millimoles per liter in a patient with classic symptoms of hyperglycemia. Chronic hyperglycemia can lead to various complications categorized into microvascular and macrovascular complications. Microvascular complications: diabetic retinopathy, damage to the blood vessels in the retina, potentially leading to blindness. Regular eye exams are crucial for early detection. Diabetic nephropathy, kidney damage resulting from high blood sugar levels leading to proteinuria and potentially end-stage renal disease, or ESRD. Management includes controlling blood pressure and blood sugar levels. Diabetic neuropathy, nerve damage leading to peripheral neuropathy, which is pain, tingling or numbness in extremities, and autonomic neuropathy, affecting digestion, heart rate and blood pressure. Macrovascular complications: cardiovascular disease, increased risk of coronary artery disease, heart attacks and strokes due to atherosclerosis. Cerebrovascular disease, increased risk of stroke due to vascular damage. Peripheral artery disease or PAD, reduced blood flow to the limbs, increasing the risk of infections and amputations. Effective management of diabetes involves a comprehensive approach. Lifestyle modifications. Diet. Focus on a balanced diet rich in whole grains, vegetables, lean proteins, and healthy fats. Monitoring carbohydrate intake is crucial to manage blood glucose levels. Meal planning. Considerations for carbohydrate counting, glycemic index, and portion control. Physical activity, regular exercise improves insulin sensitivity and aids in weight management. Aim for at least 150 minutes of moderate intensity exercise per week. Types of exercise. Aerobic, such as walking or cycling, and resistance training like weightlifting are beneficial. Weight management. Achieving and maintaining a healthy weight can significantly improve blood glucose control and reduce the risk of complications. Type 1 diabetes requires insulin therapy for all individuals with T1DM. There are various types of insulin, including rapid-acting, such as Lispro and Aspart, which are used for mealtime control. Long-acting insulins, like Glargine and Detamir, provide basal insulin coverage. For type 2 diabetes, oral hyperglycemic agents are commonly used. Metformin is the first-line treatment. It reduces hepatic glucose production and improves insulin sensitivity. Sulfonylureas stimulate insulin secretion from the pancreas. Examples include glipizide and glyburide. DPP-4 inhibitors enhance incretin levels, which increases insulin secretion and decreases glucagon levels. Sitagliptin is one such example. GLP-1 receptor agonists promote insulin secretion, suppress glucagon, and reduce appetite. Liraglutide and semaglutide fall into this category. Lastly, SGLT2 inhibitors increase glucose excretion in urine, with empagliflozin and canagliflozin being common options. Monitoring is crucial. Regular self-monitoring of blood glucose helps to assess control and adjust treatment as necessary. A1C tests should be conducted every 3 to 6 months to evaluate long-term glucose control. Education and support. Patient education is crucial for effective diabetes management. Key components include understanding diabetes, educating patients about the disease process, complications, and the importance of management. Self-monitoring, training on how to monitor blood glucose levels and interpret results. Medication management, understanding how to use insulin and oral medications correctly. And behavioral strategies, developing problem-solving skills for dietary choices and physical activity. Emerging areas of research. Research continues to advance the understanding and treatment of diabetes. Artificial pancreas, systems closed-loop systems that automatically adjust insulin delivery based on continuous glucose monitoring, improving glycemic control with less effort. New medications. Ongoing research into new classes of drugs that can aid in weight loss, improve cardiovascular outcomes and enhance glycemic control. Gene therapy, investigating potential genetic interventions to restore insulin production or enhance insulin sensitivity. Smart technology development of diabetes management apps and smart devices to facilitate blood glucose monitoring, medication reminders, and dietary tracking. Ethical considerations. Informed consent, ensuring patients understand the risks and benefits of treatments. Equitable access, addressing disparities in access to medications and healthcare. Pharmaceutical marketing. The influence of pharmaceutical marketing on prescribing practices and the importance of evidence-based medicine. Diabetes mellitus is a complex chronic condition that requires a multifaceted approach to management. By combining lifestyle modifications, appropriate medical treatment, and patient education, individuals with diabetes can achieve better control of their blood glucose levels and reduce the risk of complications. Advances in research and technology continue to enhance diabetes management, offering hope for more effective therapies in the future. If you have specific questions, need more information on a particular aspect, or want to explore another related topic, feel free to ask.